Hello and welcome to Telehealth Talk. Today we have Aneel Irfan, the CEO and president of IMST Telehealth Consulting and founder of the Telehealth Champions Network. Aneel is talking on TOPDOCS Radio with host C.W. Hall and colleague Tanya Mack, who is president of Women's Telehealth in Atlanta, Georgia. Let's listen in.
Where are we in the medical community regarding educating healthcare providers in nursing, medicine, and the allied health professions about telemedicine? What are your thoughts on that, Aneel, and what are you seeing as far as where we are today with both the infrastructure and integrating telemedicine?
Yeah, and that's something that really troubled me as I dwelled into this industry. There was really a vendor-driven, technology-focused industry, and there wasn't any education. And I realized as I did some research, and I'm from Florida, and I went to several nursing schools and medical schools, and I realized that they weren't being taught anything about telemedicine or telehealth. It just wasn't a part of their curriculum. And as they started entering the workforce, they were at a disadvantage. So I realized that, and for me, in the business that I was in, and the awareness that needs to be done, as we know, in telemedicine, I realized that there's some physicians and some clinicians that may never get it. So the ones that we need to focus on are the ones in schools. And so to see that there wasn't any education pieces there, it was very troubling to me. And it will come, but right now it's extremely lacking. And there's some programs across the country sparingly. Jefferson has created a fellowship program up in Philadelphia. And it's something that will continue to evolve. But at this present moment, the kids that are in school right now, they're in this unique place where telehealth is happening, but they're not understanding the tools or don't have their hands on the tools as of yet. Some of the reasons for that I've seen is there's still that stigma in the administrators that it's the future. It's happening right now in your communities and across the country.
Yeah, so you alluded to the fact, for the benefit of our listeners, you and I talked offline about the American Medical Association coming out with a policy statement recommending that telemedicine training be integrated into medical schools as a core competency so they can actually have the tools to do work. Can you tell us a little bit more about your understanding of this new policy? And I think they may have a consortium of some of the medical schools.
Yes, and I actually, we just released this. I wrote a very in-depth editorial in issue number 6 of Telemedicine magazine on the reluctant and history of the AMA and telemedicine. So going back now, AMA, they're very forward-thinking to a degree, and they're really focused on the doctor-patient relationship, right? And so in the beginning, though they supported telemedicine, there were still little hesitations on that doctor-patient relationship and the sacrifice there. But their stance has evolved. And it evolved to a tune where, hey, these tools are valuable. We want to put reimbursement behind them. But more importantly, developers need to prove their worth, one. And two, there needs to be, and what also came out of that recent update that you mentioned, is also ethical guidelines. But what I was happy to see, as you alluded to, is education in the curriculums. Because they realized that there's a lacking there, and this is a culture change for clinicians. And there needs to be more advocacy and more push forward for education in their medical boards. Because, medical training, as we know, is almost military-like in training. So they're really set to their ways when they leave school. So incorporating these type of tools in their training is AMA sees as a positive aspect to the new clinicians entering the workforce because they're going to be interacting with them, going forward. And what's important also that they're starting to understand, guys, is we're talking about this as telemedicine, telehealth right now in 2016. 10 years from now, it's just going to be practicing medicine. It's just going to be a part of health. We're just that amazing part of history. And that's why I take a lot of pride in, and I try to show through our Telehealth Champions Network, the amazing opportunity that we have in this age. We've seen so many things in front of our eyes come to age. Facebook, people interacting online, and our wave into society, the birth of the internet. And we're getting there as a society. That's why this is something that telemedicine and these tools are something that you can bet on, because it's something that's going to continue to grow, because that's the movement that we're going towards. But what that creates as a clinician, as a nurse, as a health information technology student, as an entrepreneur, you have an opportunity right now, and I speak about this heavily, and I take pride in this. You have a chance to be a part of history. You have a chance to mold what our clinical future is going to look like with these tools, because that's what it's going to look like with these tools are going to be used. So I try to show that kind of opportunity to entrepreneurs, nursing students, physicians, the true opportunity in telehealth that we have in the digital age of healthcare that's emerging. And I call it the triple M. It's, you can make money because you're early, you're going to make history, and also you'll make a difference because these tools are so impactful with chronic disease, the rise of chronic disease and access to healthcare. So it's really win-win-win, this industry and where we're going. It's an exciting time.
Let me move on to the next thought, Aneel. I'm interested in your thoughts about education as we move into a physician and nursing shortage over the next couple of years.
Mm-hmm.
So in my state, Georgia, we have healthcare inside of Atlanta and then kind of outside of Atlanta, with only a few major cities as big as Atlanta. So we have vast areas where we have some counties here that have no primary care. We have something like 36 counties that have no labor and delivery. Patients are driving over an hour. And so trying to get all physicians comfortable with using telemedicine as a tool, how important do you think that is, that education going into a physician nursing shortage?
Great points. And listen, let's talk about, physician shortages and clinician shortages is one, and I couple that to another thing. But let's talk about the other drivers as well. So you lay out all the drivers of the rise of telehealth: chronic disease, aging population, right? But now you're going to couple a physician shortage, nursing shortage across the country, and now you couple it with more and more people with insurance now as well, right? With Obamacare, there's a lot more people with insurance coverage. So look at that maldistribution and balance. A shortage in physicians and clinicians, more people with insurance. How do you balance that? Telemedicine.
Spread themselves out.
Exactly. Exactly. So telemedicine, telehealth are tools, just like you said, for a clinician to be in one place, basically 3 places at one time. And to dig in a little bit deeper, the shortage in mental health and behavioral health in the country and the need for it is glaring. So we're seeing a lot of rise in telepsych. We'll see a lot of that, but the specific shortage, not even clinicians all across the board, but behavioral health specifically, is glaring. So education on that is still this across the board, is raising awareness, speaking with clinicians, having them understand what their opinions are with telehealth. Have them in the conversation. When you develop a telehealth program, and things that we show in our consulting work is you have to have buy-in from the top to the bottom, from your CEO to your clinicians to your administrators, and educating them in the process of developing a telemedicine program and the culture and crawling before you're walking, understanding your laws is critical. But the shortages, and getting back to that, I think I described it. It's not even optional, I believe. I think it's going to be a necessity that we utilize telemedicine, because of you couple, the formula is just bad. You couple the physician shortages with aging populations and rise of chronic disease, more people with insurance, accountable care. I can go on and on here, but the need, it's not going to be an optional need for telehealth and telemedicine and these digital tools. It's going to be a necessity to educate and start developing and implementing these type of tools. That's why I'm worried, honestly. That's why I'm worried, because we're missing a chance with the kids that are in school now, a generation that, as you mentioned, is tech savvy enough to utilize these. We're missing a chance right now to educate them. We truly are. And that's what is a pain point for me, and that's what I'm focused on, because we're missing a chance. Yeah, it's going to come 5-10 years down the road, but we need to do it now, because the need is now, and we need to have more tech-savvy, not tech-savvy, but telehealth-savvy clinicians in the workforce, going into the workforce right now, and that's not happening, Tanya and CW.
I know the shortage is putting some pressure on states to work together to try to open up the pores a little bit on the state lines with regards to licensure, so physicians can move around and can take advantage of things like physician staffing, locum tenens, and travel, and be able to move the workforce around a little bit. And historically, that's been very challenging from state to state. They each have different processes and paperwork and so forth. I'm curious from both of you as experts around this particular model of delivery. I know it's yet another facet that's putting some pressure on licensing, because it comes into play in the telemedicine delivery model as well.
Yeah, because the people that need the care are in areas where there are no providers a lot of times. And so, and there's no reason to have a provider there. There's not really the volume that warranted. So it has been a barrier in the past. And from my opinion, it has gotten better. There is a consortium of now, I think, about 13 or 14 states.
Correct.
It does not, there is no national telemedicine medical license, though. You have to get licensed in each state where the patient is, not where the provider is. It's, on my side, as a provider, the shortest we've gotten a license is 90 days. The longest is 2 years.
Yeah.
And in states that, that was a state that had a horrible rural care problem. So you'd think they would really do it. But the consortium that I'm talking about does move through an expedited licensing process, but it doesn't bypass anything. Aneel, what's your opinion on that?
And you touched on it, and to make sure, and I'm glad you clarified as well, there is about 14-state consortium, that a compact as they call it, that has moved forward and has been proactive to get expedited licensure. It's not your license and you want to do telemedicine, you can do telemedicine in all those 14. It's expedited. So that's a real misconception. But before even that, we still need to fight on a state level provider scope. Providers that are allowed to practice and get reimbursed for telemedicine. In some states, it's only physicians in some states. Others, we need to expand it to everyone, occupational therapists, nurses. So we need to get that in order as well before we talk about licensing cross state.
Yeah, it's a good point. It's not just the physical licensing; it's all licensing.
Exactly. That's some of the things that we're fighting here in Florida. Just expanding the provider scope. I mean, we're fighting a lot of things in Florida, but on the telehealth space. But that's
you are fighting a lot down there.
Yeah, but listen, we have gotten some things, and we've gotten some wins here in Florida. So we personally are Florida Telehealth Work Group with the Telehealth Resource Center that I'm very active with. We just helped pass some legislation just recently that allows some surveying across the state for telehealth, and hopefully a payment statute next issue. But those have been the barriers, right, Tanya? Is reimbursement, the question about cross-state licensure, the provider scope, the doctor-patient relationship, going back to that, because Texas had a big fight, and I think they're still fighting Teledoc right now. The medical boards there. Is that doctor-patient relationship? Some states are saying, hey, you need to have a doctor-patient in-person relationship before you can utilize telemedicine, right? And that's going against a lot of people.
I think that's a little outdated.
Oh, absolutely.
We need to care where the care needs to be delivered, I think. However that happens, I think.
Outdated. I would say a lot of our Medicare reimbursement verbiage on telehealth is extremely outdated. When you talk about originating sites and you talk about only rural areas, that's extremely outdated, right? We need this in the urban areas. We need this in originating distance. It puts a lot of red tape where it's not needed. So hey, there's a lot of regulatory battles. I hate that we dig on that a little bit too much in a lot of our conferences. We need to get back to the education, but those are the fights that we're fighting. And honestly, with the necessity that we need to talk about, that we're talking about, and that those drivers we talked about, those things are going to have to sort themselves out.
I'd like to talk a little bit too about a whole other part of this landscape is patients using devices in their homes. Like we've talked already in this show about monitors, glucometers, Bluetooth stethoscopes, there's wireless scales, wireless devices,
Agreed.
and that kind of plugs into the remote monitoring. And how do you see education as a component? And what are you seeing in the field? We've talked about kind of two sides of the education. One is the provider side, and the other is the patient side.
Mm-hmm. Well, I want to frame this in a way, which is we got to understand first what the healthcare landscape and payment landscape is going towards. Value-based models, where you have to increase positive outcomes in the patients. Even a piece of that is patient engagement, right? And so clinicians have to use these different tools to achieve those. And what's kind of isn't related a lot of times is the different types of telehealth that are out there, right? So there's synchronous, right, which is just a simple audio video communication, and you can integrate medical devices, and that's a consult that you do. There's asynchronous, which is commonly referred to as store and forward, used for many years in teleradiology and also now dermatology, where you're capturing a secure image and you're forwarding it to a clinician for review. Another aspect, and I personally think this is going to be the most sustainable model of telehealth. It's going to be it's going to be very reimbursable. I did an article on the Connect for Health Act that we all should keep an eye on. That's getting a lot of bipartisan support and is in the House right now. Is remote patient monitoring, as I mentioned, which is where you use these tools, like you mentioned, into the home, and you're engaging them, especially for those chronic disease ailments, right? So the education that you can provide, not only while you're collecting those vitals and managing their disease remotely, but now we're seeing where you're embedding diabetic education surveys onto those monitoring devices in the home. And if you don't mind, I'll give you a quick story on that, where it hit home for me. Right, my dad gets VA benefits. He VA vet, obviously. 20-year smoker, got diagnosed with diabetes just, I would say, about a year ago. So when he got that, he goes to the Miami VA Center. When he got diagnosed, we were very skeptical. We said, hey, he's not going to manage this disease. He's not going to really stay on top of it. And of course, his levels were very erratic. So he returns to the VA. The nurse calls him in. They go, listen. And as you guys know, the VA is the largest telehealth rollout in the world, right? And they say, you know what? Your levels are erratic. Let's put you on a remote patient monitoring program. Automatically, he called me excited. He's like, Aneel, they put me on your telehealth thingamajig. And I automatically saw a change. Every morning it wakes him up. It says, good morning, time to check your vitals. It gives him tips on diet, exercise, gives him goals to hit. And let me tell you, almost 8 months later, he's basically diabetic free. He's very positive outcomes. And guys, we get a win-win there because he praises the VA, so you get patient satisfaction. We keep the patient who could be a frequent flyer out of the hospital, so we cut costs and we increase engagement. That's what we want. And that's the way we use these tools. So I think you got to make them very easy for the patients, though. You have to embed education if you're rolling out that type of program. Embed education into it because it's going to do nothing but help them. And because they're in that environment where they're at home and video tutorials on how to collect insulin, things like that, it's very impactful. So remote patient monitoring, I'm a big advocate, obviously, and I think I see it as the most sustainable model of telehealth with a combination of the other ones, but the most sustainable model of telehealth going forward. And most impactful as well.
Sounds like, in summary, I've heard you say we're starting to move the needle a little bit in formal medical education programs. We have a long way to go. Mm-hmm. Currently, there are a lot of resources available in our national, regional telehealth centers for lots of people to go there and get the education that they need as a starting point, and that we need to really embed education as part of all that we do when we roll out these these tools, and we develop them up front. Is that a fair statement?
I agree. It should be one of our kind of the phrases that we use and is invest in the knowledge before the technology. We get a lot of shiny new toy syndrome in this industry, so it's very important to invest in learning not about the toys, about telehealth. So that you hit it right on the head there. So Tanya, thank you.
Okay. Any final thoughts you have, Aneel, on telemedicine education or trends that you're excited about before we sign off?
I like that the AMA has advocated telehealth education and curriculums, as we mentioned. I would say this, that you have to be proactive if you're a nursing student or if you're an entrepreneur, if you're in college right now, and even administrators and universities listening to this. Be proactive, engage telehealth, invest it into your curriculums, and look for the opportunity. So one of the things that we say when we're trying to create with the Telehealth Champions Network is a community where we can share resources, build CME courses and have access to those, get people talking about telemedicine, building champions in our community who will lead efforts and really get excited about telemedicine and telehealth in their space. So I would encourage anyone that wants more information about the network. We're very excited about it. Me and my partner, we're going to be doing a lot of live streams on our Facebook page, which is Telehealth Champions Network. The website for our company is IMST Telehealth.com. I'm very active. My name is Aneel Irfan. If you want to look it up, I'm very active on Twitter, LinkedIn, so a lot of different channels you can reach me at. But I say, hey, take the first step, start learning about telehealth, and see the difference that you can make. The triple M, as we call it, making money, making a difference, and making history in our communities. It's an exciting time, so I encourage you to get involved, and let me show you the way.